Innervating that muscle, there is innervation that I want you guys to know. Frankie went over that for the eye. There is innervation I want you to know for the ear. The first one is going to be the nerve that innervates the stapedius muscle is the facial nerve. Okay? I know it's like more innervation, you hate innervation, but the good news is they all start with S. Okay? Stapedius, stapes, 7. So the stapes is moved by the stapedius that is innervated by 7, otherwise known as facial. Okay, so again, stapes, stapedius, 7. Absolutely know that. This is the only poster, the anatomy of the inner ear that looks like this. This is the only poster that you can see the stapedius muscle on. Okay? And the only model that you can see the stapedius muscle on is this one right here that I'm pretty sure Nuke went over, that little red square. That's our stapedius muscle, innervated by cranial nerve 7. Okay, I like to call this the Fisher-Price one because it looks like just a big plastic kid's toy. The cool thing is that you have these semicircular canals right here, and they have fluid on the inside of them, and you can actually see that on this model. That fluid helps with directionality, meaning if I were to spin in a chair about the y-axis, so the y-axis goes up and down, one of these semicircular canals is going to tell my body that I'm moving in that direction, which is pretty cool to think about. Way more than you guys need to know for lab. Absolutely know the semicircular canals and their functions for lecture. You'll probably get a couple questions on that. Meaning like, which of the following semicircular canals, the lateral, the horizontal, and the other one, which I can't even remember it.
I think it's just horizontal and lateral. Then
Oh, you have 2 laterals or something? I don't know.
Yeah, because then the ampulla and the utricle does the
True.
linear.
So you know absolutely directionality. Okay, there's a whole slide on it. He'll go over it in lecture. I'll make sure you guys study that for your final. Alright, so once again, that's your stapedius muscle innervating the stapes. It's been broken off right here. It's sitting in which window, oval or round? Oval, what window is that? Round. What's the blue thing swirling up through the cochlea? Cochlear what? Cochlear duct. Cochlear duct. There's fluid in the cochlear duct swirling up through the cochlea. Alright? What else can I show you on here? I'm going to talk about, it's really funny that he has the Australia thing to remember because I always use Austin, Texas, so AUS. Okay, now what I want you guys to know is going to be the ampulla, the utricle, and saccule. He was pointing here, okay, and I think he got a little confused. It's not the cochlea, it's going to be here. Okay, it's not a big deal, just move it, shift it over to the vestibule and the semicircular canals. All right, so let's redo AUS. Okay, so what you learned with Australia, we're just going to shift it over a little bit. Okay, once again, I go with Austin, Texas, AUS. The base of every semicircular canal is widened. It's dilated. It is an ampulla. Okay, so 13, 14, 12, okay, those are called the ampulla. The ampulla. The next bump right here on the vestibule is number 11. That's called our utricle. Okay, so A, U, S is the last one, number 9. That is our saccule. Okay, so ampulla, utricle, saccule. And like Frankie was just saying, they have a function. I honestly don't remember the functions and I can't keep them straight. So understand those for lecture, will not be on lab. Okay. Once again, ampulla, utricle, saccule. So I can show you that on an actual model. Okay. So at the base of every semicircular canal, it is dilated. It's an ampulla. If the pin is here at that second bump, it's the utricle. If the pin is here at the third bump or lump, it's called the what? Saccule. Good job, guys. Okay, that's on the vestibule. These things, this is what I think he got confused with, 1, 2, and 3 right here. That's the cupula, the cochlear, no, that's not the cochlear duct, that's basal turn. You don't need to know that. Okay, ignore that. Okay, you do not need to know any of the bumps here on the cochlea. The ampulla, utricle, and saccule are over here, right there. So don't worry, Dr. Santam won't even point here and be like, oh, which is that? So it's okay. Just know that ampulla, utricle, and saccule, Austin, Texas, or Australia, however you want to remember it, starts at the base of the semicircular canal and goes towards the cochlea. So here we can see the cochlear nerve. What nerve is here, 6 and 7? Part of vestibular. So it is part of the vestibular nerve. 5, just for funsies, is part of the facial nerve. Okay, and a lot of people are like, what is the facial nerve doing in the ear? Don't forget that the facial nerve innervates the stapedius muscle. Okay, so there's the facial nerve. It's been cut. It's going to innervate the stapedius muscle. Does that make sense? Okay, so stapedius, 7. The last thing we need to do with the ear. Let me show you this poster. This one's kind of cool. Right here. This is usually a circle he likes to use. What is this tube called right here? No. This is where it gets tricky. We're looking at the back side. Okay, this is the back side of the membrane. Okay, so through the membrane you can see the external auditory canal. This is on the inside of the ear.
Internal?
Eustachian tube. A eustachian tube, pharyngeotympanic, or auditory tube. Okay, that's a weird view. That's a view that he can cover up everything except that circle, pin that tube, and people are going to put external auditory canal, and that is not correct. Okay, so here we're looking into this ear this way. This is like the inside view of this. So we're looking at it from the other side. Okay, so that's our eustachian tube. What muscle is on top of the eustachian tube? Okay, I'm going to show you on the model. So Anoop went over this. The muscle that's on top is called the tensor tympani muscle. The tensor tympani muscle. Okay? Tensor tympani. My trick for that, TT sits on top. Tensor tympani on top. Innervated by trigeminal branch 3. All T's. So if you remember the stapes by the stapedius by 7. Okay, here we have the tensor tympani on top of the tube, innervated by trigeminal branch 3. All T's. So once again, tensor tympani innervated by trigeminal branch 3. Okay? Alright, so what is branch 3 of the trigeminal? Mandibular. Okay, so make sure you know that innervation. This, however, muscle below is called the LVP, the levator valli palantini muscle. Okay, levator valli palantini muscle. It helps move the eustachian tube because obviously that moves, it regulates pressure. Called the LVP, the levator valli palantini, innervated by cranial nerve 10. Okay, I know that's another T. My trick for this was LVP by vagus. LVP by vagus. Tensor tympani by trigeminal branch 3. LVP by vagus. Stapedius by 7. Does that help? Okay, because you absolutely need to know those. That's going to be like probably 2 questions on your test. Like it'll be really easy. This model, a poster, something very simple. One of these will be penned. First question will be what is that muscle? Second question will be what's it innervated by? So I want you guys to know that. I don't want anyone to get that wrong. Okay, again, tensor tympani on top, trigeminal branch 3, LVP by vagus, stapes, stapedius 7. Okay, remember the only place that you can pretty much see the stapedius in whole is right here on this poster, that little muscle. Obviously the muscle going to the stapes is going to be called the stapedius, and it's innervated by 7. Okay, and this is the model that you can see it on. If you see a red muscle, okay, and it's on the labyrinth, this whole collected thing is called the labyrinth, you don't really need to know that, but you see a muscle in the labyrinth, it's going to be stapedius. Okay, it's the only muscle in this area, okay, the stapedius. Alright, other than that, there's not really much I want, oh, there is something I want to show you. Okay, down here. Anytime you take a picture of this poster, any of our posters I think for this unit, there are like answer keys to all the numbers off to the side. Don't forget to take a picture of the answer keys. Okay, sometimes students will just take a picture of this and not the answers to all the labels, and they'll send me an email like the night before the test and they're like, I can't study my posters. I'm like, I can't help you. Alright, so make sure you guys are taking a picture of that key. The reason I'm telling you that is because you have the oval window here and the round window here. They both look oval to me, right? So when you're studying, you have to memorize that. You have to memorize that this is the oval and this is the round. The round is lower, okay, if you want to remember it that way. But if not, if you were in my or if I was in your shoes when I took this class, I would just straight memorize that 5 on this poster is going to be oval, 6 is round. Okay, because it was just confusing to me because they both looked oval. So oval on top, round on bottom. Oval and round. What sits in the round window? Sorry, what sits in the round window? Nothing. What sits in the oval window? The stapes. Remember, it's our bass drum pedal. Right? I don't know. Frankie's the one who plays drums. I don't know anything about drums. Okay.
Play anatomy.
Alright, so we have this picture right here. This picture is really, really good to show you the kind of, not really the lacrimal system because it doesn't have a lacrimal gland, but it shows you an important tube I want you to know. Okay, so you see a face. If you see this face, Dr. Sam will probably ask you something about the lacrimal system. Specifically, we have this tube right here. What is that tube called? Yeah, Frankie went over. It's called your nasolacrimal duct. Your nasolacrimal duct. So think about it. Lacrimal sac. Naso for nose. It connects the two. So it's called our nasolacrimal duct. Frankie said this as well. Where does it drain into? Which meatus? Middle? Inferior? I heard inferior. Inferior is the correct answer, guys. That's why when you ugly cry and it comes out of your nose, it just flows way out of your nose because it's draining all of those tears into your inferior nasal meatus. So if you're asked on your test, where is this nasolacrimal duct draining into? Okay, you're not just going to put the nose, which might be an answer. You're going to put the inferior nasal meatus. You're not going to put the inferior nasal concha, because that's part of the bone. You're going to put the inferior nasal meatus. Does that make sense? And I think I mentioned that during Unit 2, and I was like, it'll be back to haunt you guys, and there it is. So know it. Okay, so we call that the nasolacrimal duct. We call that the lacrimal sac. Up here, superior and lateral, so it's your gloomy rain cloud. That's your lacrimal gland, and it rains into your eye. Okay, not really too important to know like the very specifics of the lacrimal duct system. I would know where it drains into though. Absolutely. Okay, there are a couple of things that I want to like reinforce about the eye. Everything that Frankie mentioned, I don't think he forgot anything. So there's nothing new here on these posters that I will show you, but I can tell you some things that I know are important to know. The first one is what Frankie went over, number 5. What's that called? It's a membrane, a mucous membrane that sits on the outside of your cornea. It's called the conjunctiva, yes? Okay, here's a trick for that to help you hopefully remember. The thin mucous membrane on the outside of your eye. What's a fancy name for pink eye? Conjunctivitis. Your conjunctiva. Huh?
Everyone answers that so quickly.
Yeah, because everyone's had it when they were little. I don't know, hopefully. That they've been like being like somewhat exposed to it. Because usually when kids are small, they put hands in weird places and touch their eye. Then you get pink eye. And then your mom's like, you have conjunctivitis. And you're like, I'm a horrible person. So that's pink eye. It's your conjunctiva. It's inflamed. Anytime itis is at the end of a word, okay, hepatitis is inflammation of the liver. Conjunctivitis is inflammation of your conjunctiva. So if this is penned, you're going to bubble in conjunctiva, okay, because it's that membrane on the outside. So hopefully you'll think of conjunctivitis, conjunctiva easy. Okay, so that's what happens in pink eye, is that conjunctiva gets inflamed. Okay, Frankie went over this. All of this humor, this aqueous humor, drains and is recycled through this thing right here called the canal of who? Schlemm. It's the slim little canal. It's called the canal of Schlemm. If I were to show you that on a model, okay, it looks like this right here, where the tip of the pen is. Okay, that is the canal of Schlemm. The canal of Schlemm. I would know that. Okay, so that's the canal of Schlemm. The outer layer of the eye is called the, go to the next, what's it called? The sclera. Good job, guys. The sclera. It's also called the fibrous tunic. Okay, the second layer on the inside is called the, sorry guys. Good job, choroid or vascular. Choroid or vascular. Okay, and the innermost layer, where it's orange right here, is called the retina, or the nervous layer. Fancy name for layer is tunic. You'll see that on the board over there. Okay. All right, Frankie went over this. What is the outer, like, I guess petals called, of this flower-like muscle? Good job. I heard someone say serrata. That's exactly what I want you guys to think of. It's called the ora serrata. The ora serrata. If I show you that on a model, okay, here's the eye. You can see the ora serrata right here on the border. Okay, that's the border of the ciliary muscle. The ciliary muscle. All right. The very back side here. What's the blind spot called?
Cornea.
Optic disc. Okay, good job. Really freaky name here. What's that called? The circle. What's it start with? What letter? An M. Good job. It starts with the M. It's the macula lutea. The macula lutea. The very center of the macula lutea is where you have the most focused center of vision, so we call it the what? Fovea centralis. Beautiful. Fovea centralis. All right, a good picture of that on a poster is going to be down here. Okay, this is one of the best views that we can get. It's the back of the retina. If you were to shine a light into my eye, if you're an optometrist and look in the back, you would see something along the lines of this. Okay, this right here is the macula lutea. Macula lutea. If the pen is in the very center though, that's when you're going to bubble in fovea centralis. That's not a multiple answer question. You don't bubble in both fovea centralis and macula lutea. You only bubble in the fovea centralis. Okay? This over here is called the what? The optic disc. It's also known as the blind spot. The reason that it's your blind spot is because you have all these vessels coming out here and splaying over it. It's blocking any light from getting there. The vein and artery are called the central what? Retinal artery and vein. Central retinal artery and vein. And exactly what Frankie was saying, make sure you get a close-up view of all these on your phone because the veins are purple. So it does look like red and redder for our arteries and veins. They're not really blue, which is how it actually is in the body. You don't have blue veins, guys. It doesn't look like that. It looks purple. All right. So here we can see the central retinal artery and vein swirling around each other. Okay, we're from the back view of the eye. And then it splays over the retina. Okay. What do we call this chamber right here? Anterior chamber. What kind of humor is inside of it? Aqueous humor. What do we call this chamber back here, or this body? Vitreous body. So what kind of humor does it have? Really easy. Vitreous humor. Okay, so aqueous, interior, vitreous, vitreous. Okay, surrounding the lens is going to be the posterior chamber, also with aqueous humor. Okay, what do we call those lines right there, holding up the lens like a marionette doll? Okay, there's like 3 names for them you might see on different posters. One is ciliary zonule, one is suspensory fiber, and then whatever I've missed. It's written all up on the board. Suspensory ligaments or zonule fibers or ciliary zonules. Okay, or ciliary zonules. Don't worry and freak out about that word. It's not normally a multiple answer question. There's just a lot of different terms on the different posters that we have. All right. Here we have a really weird view. I want you guys to memorize that this is lateral and this is top. Okay, that's going to help you because if he covers this, you got to know you're looking at the top view to know which muscle that you're pointing at or he's pointing at. Okay, so this is the top view. What is this straight muscle right here? Good job. Superior rectus. Superior rectus is innervated by what? Cranial nerve number. I heard someone say it. No, not 4. Not superior oblique. It's just superior rectus, so it's innervated by 3. Okay? What's this one right here on the lateral side going straight to it? Lateral rectus, innervated by cranial nerve number 6. Good job, guys. 6. This one right here on top is going to sling over. Kind of goes at an angle at the superior aspect, so it's the superior oblique, innervated by cranial nerve number 4. Excellent job. So SO4, LR6, EE3, which means that the inferior rectus, the inferior oblique, the medial rectus, the superior rectus are all innervated by the ocular motor, which would make sense, helps your eyes move, the ocular motor. Okay? Let's take one more second to look at this poster that Frankie went over, the blue one. The reason why he spent so long on this is because it's a weird view of the eye, and it comes up a lot on the test, right? Yeah, he's got 3 of these. Okay, so the view of the eye, once again, you're looking from the back of me, through my head, out through my eye. So it's a weird view. On here on the top, we can see this weird muscle going off at an angle. 42 is the superior oblique, innervated by cranial nerve number 4. What's the name for 4? Trochlear. Remember O2, trochlear. Okay. This muscle right here, 38, is called the superior rectus, innervated by cranial nerve number 3. Good job, guys. Okay, this one on the side, we know this is the medial side because the superior oblique goes towards the medial side, so that's why we know this is the medial rectus, innervated by cranial nerve number 3. Okay, good job. Down here, going straight away on the bottom, is the inferior rectus, innervated by cranial nerve 3. Okay, good job. 43 right here. This is going to be the inferior oblique because we can see the fibers here going off at an angle. The inferior oblique is innervated by cranial nerve 3. Good job. And this means that the last one here on the lateral side, the reason it looks like it's going down at an angle is because it's just flopping over. If we were to pull it straight back, that's how it would look in the body. So we know this is the lateral rectus, innervated by cranial nerve number 6. Good job. Know your innervations, know the numbers. There is a cadaver that shows, it's like one of the surgical forks, and they're peeling back the skin on the outside of the eye, like on the side view, and they're looking at either the medial or the lateral aspect. I don't know which one it is, I can't remember, but it will say on your cadaver when you're studying them. Know that view of the muscles, okay? That one comes up a lot, okay? It's like a lateral or medial view, I think a lateral view of the eyes, okay, of the muscles of the eye, and then the question would be like, what is this muscle and what innervates this muscle? So don't forget, lateral rectus is 6, superior oblique is 4, and everything else is 3. On the board over here, I drew like some eyes and the cranial nerves that either close the lids or open the lids, but you guys don't need to know that. It's just a little like fun factoid that is not important for this class, okay? If you're curious, cranial nerve 3, like 3 pillars, opens your eyes. Cranial nerve 7 closes your eye. It looks like a fish hook. So that's the trick for that. It's important for neurobiology if you take that class. Okay. All right, the other thing I want to show you on this poster, this blue poster, is going to be that blue circle right there. What's that blue circle called? Number 7 down here as well. Canal of Schlemm. Good job, guys. Canal of Schlemm. Okay, again, it's called the Canal of Schlemm. Give me 5 more minutes and I'll let you guys go. 12. What is 12? The fornix. Good job. 26. What's it called? Choroid plexus. Below that is the habenula. Good job, guys. These are not easy words, I know. This one right here, it makes melatonin. 23 is called the pineal body. 13 and 9. We have the posterior and the anterior what? Commissure. Good job, guys. Number 20 right here is called the
Subcalamus.